So I guess it's complex and quite multifactorial, but I would say that a likely reason for the increase at this time of year is due to the fact that vaccination rates in the UK, current data indicates that they're down, so from about 77% to 71%. And also the current vaccine programme this year doesn't include those aged 50 to 65. So in general, there are fewer people vaccinated as a result.
And just a 6% drop in vaccination rates, that can have that kind of effect, can it?
Well, if you consider the drop in over 65s by that amount, there are obviously different cohorts of individuals, so those who are immune compromised and children as well. But we're seeing in the UK a similar trend across all of these groups, so a general reduction. And then also, if you remove that whole cohort between 50 and 65 who may have been eligible next year, that could actually result in quite a large percentage decrease in the number of people being vaccinated.
And so the obvious question after that is, how is it looking on the Isle of Man? How are we faring so far for flu numbers?
In terms of drawing parallels to the Isle of Man, we haven't seen a similar trend here, but obviously we're keeping a really close eye on how things progress, in touch with our colleagues at Nobles Hospital looking for an increase in cases, and those working in primary care as well, so our GP partners. Yeah, we're not seeing anything similar at this particular point in time.
Any concerns to be drawn from that, though, about the weeks ahead?
Well, I mean, I would say that the best thing that people can do in order to try and prevent any stresses on the healthcare system over here, or being unwell, is to check on the Isle of Man Public Health website to see if you're eligible for vaccination. And if you are eligible, to contact your GP practice or the vaccination hub, depending on your eligibility, and get a vaccine, because that is the simplest and most effective way to reduce your risk of influenza infection this season. And I suppose from a public health perspective, we're constantly horizon scanning to ensure that we're prepared for any potential outbreak.
You mentioned vaccine numbers, vaccine intake is down in England. Is that
Mhm.
similar over here as well this year?
In terms of vaccine numbers on the island, the way that the data is recorded means that a lot of the vaccines are drawn into the same data pool, and then we have to pull out individual data, and that tends to happen at the end of the year. So at the moment, we are seeing a trend year on year from 21-22 to now. So the last full set of data that I have access to being last year's, which indicate that year on year we're seeing a similar decrease to the United Kingdom in terms of vaccine uptake. So I would say from inference that it's probably very similar in terms of uptake on the island, being down to a similar percentage that it is in the UK.
And you might have touched on this before, apologies, but we were talking about the cases in England. They're saying they're highest in 5 to 14-year-olds. Why is it that age group in particular is susceptible?
Well, that's quite a difficult one to answer, and I'm not sure that we quite have an answer for that yet. So the number of vaccines that have been given in school children last year is similar. I mean, that doesn't tend to be up to 15 years of age, but it's offered through the school vaccination program to younger children. But it could be linked to the fact that, again, we have a lower number of people vaccinated, which means a higher amount of circulating disease, which then means that you will also get an increase in all cohorts. But I suppose that schools are an area where spread of illness can happen quite rapidly, and this is the time of year where lots of children inside in classrooms, and that's a real opportunity for the spread of influenza.
And you mentioned to get a flu vaccine if possible, if eligible, but what other advice have you got for people going forward this winter?
Well, so obviously vaccination, the number one way to reduce your own risk and the risk to those around you, your loved ones. But it's also important to keep up healthy behaviours to reduce the spread of any respiratory illnesses like flu, but also that includes COVID, respiratory syncytial virus, and indeed other seasonal illnesses like norovirus. So it's just really important. So respiratory etiquette. So if you're coughing, sneezing, making sure you're catching that in a hanky or in the crook of your arm. If you do feel unwell, try and stay away from the workplace or from school, to not spread it to other people. And then other things like washing your hands regularly for 20 seconds, after you've used the bathroom. These sort of simple things that you can do to reduce the potential spread of viruses at this time of year is really important.
Talking about flu numbers, but many people have seen on the front of various newspapers this morning this term quaddemic. Now, what exactly is meant by that?
Well, I suppose that's referring to the fact that we have 4 seasonal illnesses which are currently circulating in relatively high numbers in the UK. So that includes influenza, respiratory syncytial virus or RSV, norovirus, and COVID-19. Now, a lot of the messaging around, respiratory etiquette, like I touched on before, and making sure that you have good hand hygiene, that is common across all of these illnesses. But of course, 3 of these will have groups of individuals who can go and have vaccinations. So that's flu, RSV, and COVID. So by getting vaccinated, practicing good hygiene, and staying informed, we can all act together as a community and support our healthcare system during what is always a challenging period for the healthcare system.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.